It's unfortunate that we have to get to this level.
This emergency room of Montreal's Maisonneuve-Rosemont hospital was closed overnight Monday, with only the most urgent cases being accepted. It reopened at 8 a.m. Tuesday morning. This as nurses on the evening shift held a sit-in, threatening to resign if changes are not made.
For us, the solution is very clear. We need an approach from the minister to completely eradicate this practice that has grown exponentially in the last few months and the last few years, which is mandatory overtime.
Around 100 nurses from Maisonneuve-Rosemont Hospital signed a petition calling for the immediate resignation of their manager, who is accused of imposing what they say is unreasonable mandatory overtime and mismanaging staff shortages. The CIUS de l'Est de l'île de Montréal confirmed Tuesday that the ER head was moved to a different position.
La situation est extrêmement difficile.
The situation is extremely difficult, and the person in question is not responsible for the fact that we receive more patients than our capacity to treat them. Some nurses threatening to quit and walk off the job en masse Wednesday if their demands are not met.
We're taking this situation very seriously.
Quebec Health Minister Dube announced that an outside mediator has been mandated to meet with both sides.
It's normal in those tough situations that we act with an external person that have a fresh look at it.
The mandatory overtime and working shifts that were not planned affecting the nurses' work-life balance.
It's above and beyond what's acceptable in this day and age.
The hospital itself has been falling apart for years. If you have an emergency, you will be seen. It's when you need to go to a hospital, though, just make sure that you're looking at the news to see if, we don't want the emergency to be closed again. And use the services like 811 and all the other services to just lessen the impact.
Ambulances were redirected during the ER closure, and this will also be one of the solutions for now, as results to further discussions are pending to reduce the volume at the hospital, allowing some respite to the nurses.
My support is to make sure that all the other hospitals, until we solve these issues, are helping them.
Our healthcare professionals, after 2.5 years of a pandemic, they've gone above and beyond what is required of them.
In Montreal, Pamela Pagano, City News.